everybody. We are here this morning at Princeton Baptist Medical Center, and we are going to talk about our kickoff for Breast Cancer Awareness Month and Mammothon 2018. I have Vonda Ellis and Vonda Hayes here with us this morning, and we're going to talk about the importance of having a mammogram. Ladies, tell us a little bit about what you do here at Princeton.
Well, I am an RN, and I work as a navigator and survivorship supervisor, and so I work with the navigators here at Princeton, and we work very closely with our breast center and with our patients who are having the mammograms, and we do a lot of the follow-up for the mammograms, and we're available to assist the physicians with their biopsies, and we can talk about that a little bit later on.
Wonderful.
I am a mammotech, which means x-ray and mammo. You specialize in mammo. I do mammograms and I do DEXAs, but in the mammo department, we do screenings, diagnostics. Diagnostics are when either a patient has to come back after having a mammogram and there's a problem, or they come in with an initial problem. We are also, as techs, involved in biopsies and also in needle localizations after the biopsies when the patient is going to be going on to surgery.
Wow, it sounds like y'all have a great deal of responsibility here, and we appreciate y'all taking some time just to be with us this morning and talk about the importance of this. If y'all are ready, let's dive into some of the questions. I think these are going to be some of the most common questions that probably our audience has, so hopefully we can get some answers for you. Talk a little bit about what exactly is a mammogram.
A mammogram is a specialized type of x-ray. It is an x-ray that is utilized to visualize the breast tissue. It's a little different than x-raying bone or doing a CT or something on that line in the positioning, in the technique used, and the proximity you have to your patient. But it, for the most part, is an x-ray of the breast.
Awesome. Now tell us why getting a mammogram is so important. As we celebrate breast cancer awareness, why is it so important for our audience to know that they should be getting these?
Well, to have a mammogram is very important because a mammogram will help to detect an early abnormality before it gets to the point that it can be more complicated to treat. And by having an early mammogram and having an early detection of a problem, you can tell if it's actually breast cancer or not. A lot of times we do biopsies and it's nothing but just normal tissue that looks abnormal under their x-ray. But it can also help to reach a cure for breast cancer and a better management.
And early detection is key.
It's key.
It's key, ladies. When should women start getting their mammogram?
Here at Princeton, we follow the guidelines of the ACR, which is American College of Radiology. According to the ACR, a woman begins her yearly exams or yearly mammograms at the age of 40. Now, if you have a strong family history, if other complications, you've had a palpable abnormality, that is something you discuss with your physician and may vary on when you start your screenings. But the base guideline is that you begin at 40.
Very good. I think that's something that most women are aware of, but I think that sometimes they're a little leery of coming in. Mm-hmm. So tell us a little bit about what to expect when you come in for your mammogram. Kind of walk us through that patient experience.
As a tech, you understand the excitement of it all, or the anxiety of it all, but the hype as far as how bad the mammo is much worse than the actual event. When you get here, you're going to fill out some paperwork. It's really important for us and for the radiologist to have history on you as far as anything going on with your, that's went with your family, your personal history, that kind of thing. So you've got some paperwork to fill out. But that's important because it tells us about you and it tells the doctor about you. After you fill out your paperwork, we'll take you into a room, put you in a gown, kind of get you settled in. And the room we use is just for females. You're going to go in, you're going to get a pink gown, you're going to put it on, you're going to sit down, and then we're going to bring you in the back side of the mammo suite. After that, is the dreaded compression. But compression-wise, most of the time, if you can talk yourself into relaxing, that's going to help a lot because your breast tissue lies directly in front of your muscle. that muscle, I'm trying to include that in my pictures. Because when I include that on my picture, the radiologist knows I have all your breast because it's directly behind it. That muscle's balled up and tight and tense, it's gonna pinch worse. So shoulders down, blow it out, try to relax. I get better pictures and you don't get, yours is much more a comfortable procedure. It is uncomfortable, but truly, I have them also. It's worth the discomfort to have your screening done.
Right. And I personally can say that I've had a tumor, not cancerous, but a tumor removed from my right breast and my left breast. So when I come for my mammograms, I'm glad when Vonda and the others pinched me, because I know that they've got all of my breast tissue, and I'll be saying, make sure you get all this under the arm now, pull all this over there, because I want it all to be looked at.
Right. So it's uncomfortable,
Right.
but tolerable.
Yes.
Okay.
Yes.
Definitely.
Absolutely.
Definitely want to make sure people are aware.
It's more of a discomfort than a pain.
Right.
Right.
And and it's a matter of it. We compress. We tell you to hold your breath, and after you hold your breath, the exposure's made. The minute the exposure's over, the machine releases.
Yeah.
You're not trapped. You're not stuck. My job isn't to put you in there and hold you for 20 minutes. That's not what we do. But yeah, you're going to hold your breath, and once you're released, you breathe. You step back, and a normal mammogram is going to be four images, 2 of each side. Occasionally, you're going to do more images, but for the most part, you're going to go in with 2 images of each breast, and it's tolerable, yes.
Now you mentioned it's just going to be roughly 2 images of each breast. How long does a normal mammogram take? Just how long should they expect? Sometimes people dread going to a doctor's appointment because it takes a long time. How long before, like, kind of door to door, in and out?
In and out, with paperwork and everything.
Sure.
Probably 30 to 45 minutes. Because you're going to be in the room with the tech for 10 to 15. The actual mammo itself is going to be about 10 to 15. But your paperwork and, changing clothes, and give it a good 30 to 45 minutes, but
Not bad.
not bad.
Not bad at all.
One of the things too that a lot of people worry about is that what about parking, and what do I do for that? And we're very fortunate here that there is parking available, and if someone is not able to ambulate, I also have trouble with arthritis, so if I need to go somewhere and I have to think I'm going to have to walk from the place, we do have valet parking. Of course, you have to pay for it, but that's available also. Plus, we have parking that's very close to the center here, and it's not a great distance from where you register to where you get your treatment.
That's great. That's a great amenity. Something great for our consumers to know about. When a patient comes in for their mammogram, is there something that you would recommend that they should wear the day of to make their process a little bit easier?
Yes. I would wear something that I could undress from the waist up. And we all kind of tend to dress a little bit to go to the doctor. But if you come in and you have a dress on, it's going to mean that you're going to have to undress completely because you have to take it off, because everything has to come off your chest. So if I was going in for my mammogram, I would wear a skirt or pants so that I could just remove my top. Also, it's very important that you don't wear deodorant and you don't wear any talcum powders or lotions underneath your breast, because sometimes those things can show up and cause a false reading. You can end up with what will look like calcifications, but it'll be your deodorant. And you don't want to have to come back and see me for what looks like calcifications, and you get back and I'm doing additional views and it's deodorant. So if you do wear it and you do come in, we have wipes. Just remind the tech that you've got your deodorant on, and we'll give you something to remove it. But yeah, those are 2 things that you want to make sure that if you have them on, that we remove them, or if you just want to bring it with you and put it on after the exam, that's fine also.
And the calcifications are what the radiologists are looking for, because that can show them that there's an abnormality in the breast.
Great tip for ladies. Thinking about, sometimes women are a little sensitive certain times of the month. Is there a better time than another for a woman to come and get a mammogram?
We as women vary, but for the most part, if you'll notice, you're more sensitive the week before your cycle. Your breasts are more tender. You're not going to want me to compress your breast at that point of the month. So if your cycle is your normal cycle, I would schedule my mammogram the week after my cycle, not the week before.
Very good. Now this is something that I think is very important to make sure that we talk about. A lot of our patients have breast implants. Is there any reason why they should avoid a mammogram?
No, definitely.
They should come in just like any other patient.
Yes.
Is there any certain procedures that you guys do to kind of work around that implant as you're taking your images?
When someone has implants, there's going to be additional views taken.
Okay.
Because the implant can be in the way. It can, it'll block some image. So according to how the implant lies and according to you, majority of the time we will do what's called displacement. The implant where we'll do one set of views, like I told you we do 4.
Mm-hmm.
We'll do one set of images with little or no compression that will include the implant. So we can visualize the wall of the implant, make sure there's nothing going on with it itself. Then we'll start over and we will do images where you're pushing the implant actually out of the picture and do just the breast tissue without visualizing the implant.
Very good. I think that's important. Sometimes people think, oh, I won't need that, but
you
it's
still
very
have
important.
you still have breast tissue.
Absolutely.
It still needs to be imaged.
Absolutely.
Yes, definitely.
Definitely. Great. After you've had your mammogram, how long does it normally take before you would get your results?
Well, one thing that we do as navigators, as the nurses, is that on a daily basis we check all the mammograms that have been done the day before. You give one at least 24 hours for the radiologist to have read them. And we go through that and we pick out anything that has been flagged as an abnormality. And what we look for, and which Vonda can address probably better than me, is that we have something called BIRADS, and they go from 0 to 6.
Okay.
And on a 4 or a 5 or a 0, those mean the 4s and 5s that there's something been detected that might be abnormal. Doesn't mean it is, but there's something that needs to have further testing done. So the nurse will pull those mammograms out. She will contact the ordering physician. She will let them know what the radiologist has suggested, and then we will follow up on that to make sure that the patient has had the additional testing, which might be an ultrasound of the breast or an MRI of the breast, or as Vonda had mentioned earlier, a lot of times what we have is just regular screening mammograms because we don't detect anything. So they'll come back and have a diagnostic, which involves more views and more steps to do. The other thing also is that if they're here and they're having their mammogram done and the radiologist feels like that they see something that needs to be biopsied, they'll call one of our nurses and they'll come over and talk with the patient, explain what's going to be done, and then they will actually make the appointment for them to see a surgeon of their choice, or if they don't have a surgeon, then we will, tell them the ones that are available. And so we make those appointments and make sure that the surgeon and the ordering physician receives a copy of the mammogram and a copy of what has been suggested to be done. And then actually when they come back and have it, as Vonda had said earlier, then we will come and assist with the ultrasound biopsy or the stereotactic biopsy. And so one of the RNs will be there and we'll help the surgeon with that. And also the mammotechs are involved with that as well, the ultrasound techs also. So it's a full house when we have something that comes back.
Definitely.
And then if it is determined that it is cancer, then a patient needs to have additional lumpectomy. We're very fortunate, all of us in this room, that now we don't have to have your breast totally removed as they did many years ago. You can have what's called a lumpectomy and remove that area and then have treatments. So when the doctor is going to do the lumpectomy, make sure that they're in the area they need to be. They do something called a needle lock, and that's where the mammotech is involved again. It's done in this area. All of this is done in this area where we're sitting now, so you don't have to traipse all over the hospital or to other departments. And one of the nurses again will come over, be present. The mammotech is they're the star of the show on that, because they're the ones that tell the doctor, well, this is what we saw and this is where it is. And then the radiologist will insert a very fine wire in that area. You don't have to be put to sleep for that. They put a little anesthesia there, and then they go to surgery, and that helps then the surgeon know exactly where they need to biopsy. So we've come a long way in the past. I'm not even going to say how long I've been doing this. I'm an old woman, so it's a long time.
Well, no, it sounds like the team here at Princeton really just kind of has this process, just really under control, really prepared to make the experience as seamless as possible for our
Yes.
patients.
Yes, definitely.
We definitely appreciate that. So now let's talk about those folks out there who haven't had their mammogram yet. Tell us a little bit about the promotion that we're running here this month called Mammothon.
Okay. You want me to address the Mammothon?
Yes.
Okay. Well, in the month of October, we're very fortunate here at Princeton that we do have something called a Mammothon, and that basically you can come in and have your mammogram done for $99, okay? Which is cheap if you know anything about having x-rays and things done. And this is especially helpful for patients who do not have insurance, or that possibly their insurance doesn't pay for the mammograms, or they have a large copay. So you can make your appointment, and you come in and you do your mammogram. And through the month of October, we have certain things that we do on each day.
Oh, okay.
So that we, some days we give out cookies, and we give out little special little bags with little goodie bags. Sometimes we have all sorts of little goodie things that we do on different days, so that you can have something special to come by and have your mammogram done.
Wonderful. Every incentive helps, right, ladies?
That's right.
Is there anyone that has any questions or anything?
Yes, we have one question from the Facebook audience. When is it okay to stop having mammograms?
Actually, I would say never.
Okay.
There are some train of thought that maybe when you get to be in your 80s, maybe stop.
Okay.
But that is, again, as Vonda has said earlier, that's an individual from what your history is, your family history is, and what your doctor recommends. But basically, never.
I like that. I think it's so important. Even when you do get to a certain age, I think it's very important just to still consider your health as a priority.
That's
so
right.
I think that's very good advice.
It's very important to remember that early detection, that's the key to the treatment, and for being able to receive a cure and receive treatments that are a lot less aggressive. And I would add that we have come so far in all that we do that a lot of times we're picking up things so early that patients just have to have a lumpectomy and may not even have to have the treatments. But that depends on what it is.
But see, catching it early also, in having it yearly, when you have your yearly mammogram, and you're instead of every 3 years or every when you have your yearly, they put your films up from last year and this year every time, and they're comparing, and they're not just looking at your breast today, they're looking at your breast today compared to your breast 3 years ago or 2 years ago. And are there changes happening within your breast? Are those normal changes happening within your breast? And then that comes back to the diagnostic. You come in for your screening and, oh, well, this looks different.
Right.
Let's verify that this is a normal change. They bring you back, they'll do spot compressions, or they'll do mag views or something along that line to verify that what's changing in your breast is a normal change. We have normal changes because our hormone levels change.
Right.
But you want to verify that every change is a normal change that happens within your breast.
Right, and that's another good point to make as well, is that you really need to be consistent, not only with having the mammogram, but having it in the same place, so that the doctors have those available to look at. And we do have another special program that we have here at Princeton, is that every Wednesday we have what we call our breast conference, and they present patients who have come in for biopsies, and they discuss the fact of whether what their mammograms showed, what their biopsies have shown, whether that looks as if though that was indeed what was the problem. And then we also have another program that meets once a month where we're called a concordance. And in the concordance, if you come in and have a biopsy done and it's negative, you automatically, your name and your reports, your mammograms and your biopsies goes to the concordance conference, and then the surgeon and the radiologist and the pathologist sit down and look at those and say, you know what, that is negative, that is not a cancer. Or you know what, I think that maybe we might have missed right where those little calcifications were, and we want to go back in and do that. So that's another plus that we have that we offer here.
No, that's great. It's like a team approach.
Definitely.
I mean, it really is. I mean, so many different specialties working together to make sure they're providing the best care.
Absolutely.
That's awesome. That's great.
One more question from the audience.
Great.
How do we make an appointment to get a mammogram at Princeton?
And I think you have.
I do. I have some information on that. What we would encourage everyone to do, if you visit our URL, which is related to Mammothon going on the entire month of October, you can visit brookwoodbaptisthealth.com/mymammo. And that will actually show all of our facilities, all of their special rates that they're offering, and there's information there where you can make your appointment at the location that's most convenient for you.
One more question from the
Yeah.
audience, and then we're cutting it off. Is it safe to have a mammogram if you're breastfeeding?
That's going to be when you're going to go through your obstetrician, gynecologist, talk with them. Is at this point, is it necessary for you to have your mammogram? Because if your breasts are dense anyway, because you're young, obviously, if you're breastfeeding, you're young enough that your hormone levels are elevated. Breast milk is going to make your breast even denser. I know that it can be done in certain times, but again, go through your obstetrician gynecologist. You may be required to pump your breast before you have your mammogram done. There's certain things that would have to happen. So I would talk to my physician and not schedule myself as a screening. I would go through my doctor.
Right. And it's important that if you are pregnant or have already delivered and are breastfeeding, that if you've detected a change in your breast, then you need to make sure that your gynecologist knows that, and that that is followed up on, and that you just don't think, well, it's just because I'm breastfeeding, or it's just because I'm pregnant, or I just had a baby. So
see, that goes into, and even you're talking with breastfeeding with everyone, you know your breast better than anyone else does. That's why your monthly self-breast exams are so important, because your doctor examines you once a year. And you're going to recognize a change in your breast before your physician will notice a change in your breast. You may have your mammogram and 6 months later feel something in your breast. Don't wait 6 more months to come back for your next screening. You have felt something in your breast. Contact your doctor. I have felt something in my breast. That would be a diagnostic study. You can have a diagnostic study in between your screening studies. It's a different procedure. You don't have to wait till your 1 year mark. That's something that a lot of women don't understand. So if you're breastfeeding or you're not breastfeeding, if there's something going on that's a change in your breast, you think it's abnormal, call your physician.
Take action.
Yes.
Right. And if your physician doesn't take action and you really feel like it's something, get another physician.
Second opinion.
Get a second opinion.
Second opinion.
Right. That's right. Absolutely.
Great. Well, thank you, ladies. I feel like this has been super informative for our audience. If anyone has any more questions, again, visit brookwoodbaptisthealth.com/mymammo to find out more. Thanks. Have a great day.
Thank you.